We have a starter here on thrombosis. You've been asked to demonstrate your knowledge and understanding here to a level C. During the formation of a thrombus, fibrin is involved in which of the 4 steps, A, B, C or D? The correct answer should be C, that fibrin forms a meshwork to clot the blood. In this PowerPoint, we are going to be focusing on peripheral vascular disease. And from page 34 of your student guide, we're going to state the causes of peripheral vascular disease, describe peripheral vascular disease and the effect it has on various parts of the body, and identify the cause of DVT and its link to pulmonary embolism. The peripheral arteries are those other than the aorta and coronary and carotid arteries. When any of the peripheral arteries are affected by arteriosclerosis, their central cavity becomes narrower, as we've been looking at, and as the diagrams show on the screen. So here we have a normal artery in the leg, followed by an artery that's been significantly affected by arteriosclerosis. The process of atherosclerosis is exactly the same, whether it's PVD, whether it's in the leg, or whether it's in a coronary artery or the carotid artery. So we're looking at the same process for atherosclerosis, but the process of the arteriosclerosis leads to peripheral vascular disease, which most commonly affects the leg arteries. When these blood vessels suffer an obstruction of this type, blood flow is restricted and pain is felt in the leg muscles because they are receiving an inadequate supply of oxygen. So with peripheral vascular disease, otherwise known as PVD, is caused by the narrowing of the arteries due to arteriosclerosis. Arteriosclerosis of arteries other than those of the heart or the brain is what leads to PVD. So basically any artery that's not the heart or the brain would come under the bracket of PVD. The arteries in the legs are the most commonly affected. Pain is experienced in the leg muscles due to a limited supply of oxygen. Deep vein thrombosis is the formation of a thrombus or a blood clot in a vein. Deep vein thrombosis is most commonly associated with a blood clot appearing in one of the calves of the lower leg. Normally this process causes the affected extremity or the affected outside part of the leg to become painful and swell, and you might be able to see that from the image in front of you. In addition, veins close to the surface of the skin can become engorged with blood. Again, you can see that on the picture of the person's legs, that the veins are coming up to the surface of the skin. With deep vein thrombosis, what we are seeing is that these clots or a thrombus are starting to accumulate within the valves of the veins that are leading back up from the legs. If a thrombus in a vein breaks free, a serious complication may arise. The clot, now known as an embolus, is transported via the vena cava and heart chambers to the pulmonary artery, where it may block a small arterial branch. This serious situation, which affects a lung, is called a pulmonary embolism, and it's characterised by symptoms such as chest pains, breathing difficulties and palpitations. Treatment takes the form of anticoagulant drugs or, in severe cases, thrombolytic drugs. If untreated, a pulmonary embolism can lead to collapse and sudden death. If you're in class, I would be issuing this assessment standard question. It is very difficult to be able to see it on the screen just because of the nature of the question. The answers are available if you click through, so if you have perhaps been in class and have a copy of this past paper, then the answers are available in the next couple of slides, just to show you so that you can double check. That's the end of this PowerPoint. I would ask you to reflect upon the 3 learning intentions highlighted and evaluate your own learning and understanding of peripheral vascular disease.